missing a red flag will be a blunder or a critical error, and all you need to do to fail your exam or you fail your station is miss a red flag. Okay, so what is a red flag? A red flag is a diagnosis that will actually, kill the patient. Okay, so all you need to do about thinking about red flags is ask yourself, what will kill this patient with this symptom? Okay, let me give you an example. A patient has come to you with cough, and you should never miss red flags for any symptom. Okay, so every exam, what they're going to assess you is to see whether you are a safe doctor or not. So when they look at that, how they can tell you if you are a safe doctor or not is whether you miss a red flag or not. Because if you don't miss a red flag, you are a safe doctor because you are not killing the patient or you are not causing harm to the patient. So it is very important for you not to miss the red flag. Okay, so if you have a patient who has come to you complaining of cough, ask yourself, what will kill this patient with this cough, with this symptom, and the symptom is cough. So you need to think about pneumonia. Okay, so severe asthma, all these conditions can actually present with cough. So that is what you need to think, and that is a red flag. Okay, so in your exam, make sure you actually think about red flags. Let me give you another example. Okay, so a patient has come to you with a rash. Okay, so ask yourself, what will kill this patient with this rash? Okay, so then you need to get answers like meningitis or some bleeding disorders. So you need to ask yourself, what will kill this patient with this symptom, and you will get the answer. Okay, once you get the answer, when you're taking history, make sure you rule out that important differential diagnosis. Okay, if it is meningitis in a child with a rash, ask the parent or ask the child or ask the examiner, if there is a rash, and if there is fever, if there is neck stiffness, if there is difficulty seeing lights or photophobia. Okay, so this is how you rule out your red flags. Okay, so make sure you never miss a red flag, because all you need to do to fail a station is just miss a red flag. They are that important. The same thing applies when you're actually practicing, in your daily life. If you miss a red flag, you're causing harm to the patient and giving scope for medical legal consequences. Lawyers are waiting there. If you do a mistake, the patient will sue you and you will be in big trouble. So make sure you don't miss a red flag. If you miss something simple like a viral upper respiratory infection, nothing will happen. But if you miss a serious cause, then you're in trouble. Okay, so always be open-minded.